Good day, my name is John Mark Bautista of Ateneo de Manila University of the Philippines, and I'm here to present our paper titled Comparative Analysis of ML Algorithms for Predictive Prenatal Monitoring. So, neonatal deaths or prenatal deaths are deaths of newborn infant and premature deaths have declined throughout the years by advancement in technology and better medical practices. However, some women in low income and even middle income sectors still lag behind as they are unable to receive adequate prenatal care. And this is prominent in countries like the Philippines, where there are areas where only 33% of pregnant women see a doctor for prenatal care, while more than half only see midwives or barangay healthcare workers. Now, barangay health workers are government trained employees that are assigned to a particular local area or small town, and they serve as the first respondents for any healthcare concern for the local townsmen. However, they face challenges such as inadequate training and equipment to foster pregnant women in their community paired with the high volume of patients. So the common reasons for inadequate prenatal health care in the Philippines are women residing in isolated areas, unaffordability for some women, lack of reliable equipment and doctors in certain regions. So the solution we are focusing on in this study is on prenatal care. Because early detection of high-risk pregnancies by prenatal health care could reduce complications during labor and postpartum development. Health workers and even doctors with proper information on high-risk and low-risk pregnant women could give special treatment and focus to vulnerable women while not increasing the risk of healthy mothers. So in this study, we're giving emphasis on women having access to and having frequent prenatal care, especially for high-risk women with high-risk pregnancies. So the solution we are proposing is introducing a system for a low-cost remote prenatal care system with a prediction algorithm. So with this setup, it's the use of a reliable remote diagnosis and assessment can be integral for women living in isolated areas as they do not need to travel to further areas just to receive adequate prenatal care. Doctors can also be more accessible with this setup because you can access them uh, via internet or other channels of communication. The prediction algorithm can serve as a pre-diagnosis tool for health workers to detect early high-risk pregnancies. And the remote setup, since it is easily usable and accessible, can actually encourage women to get prenatal care more often or more frequently rather. So in building the system, it's composed of three parts: the mobile application for doctor and patient, the cloud file store or file database to save the data from the patient. The prediction algorithm part will process the input data from the cloud file store and will return the result of the patient, whether they are high risk or low risk pregnancy. The mobile application part is the app interface where the patient and doctor can interact and input data. The features include the patient can input data per visit. So currently it has a maximum of 4 visits. Patient can input data based on the form provided by the app, and the result of the machine learning system can be viewed in the app for doctors and patients to see. So the database storage, it stores the patient info acquired from the application, and it also stores the result of the predicting software. So we are using an app called Cloud Firebase for the data storage, and it will be connected to the mobile app and Python app for running the predicting software. So this software, the predicting software, analyzes the data from the patient form and predicts whether the pregnancy is high risk or not. So we generated by using machine learning algorithm. So the machine learning algorithms to test include decision tree, random forest decision tree, k-nearest neighbor, and support vector machines. So these machine learning algorithms were based on algorithms that were used on previous studies and our own assessment whether they are applicable for the use case in our study. So the machine learning algorithm to generate predicting software, we did a number of steps. So first is the pre-process of data. The dataset was acquired from the website Demographic Health Survey, or DHS, which is publicly accessible if you sign up for an account. Input dataset. We inputted the dataset to the machine learning algorithms for testing and training. And after the models were generated, we would compare the performances with each other, and if applicable, would tune the parameters of each machine learning algorithm based on the result. So if the tuning part is whether we can get a better result or a more accurate model by tuning the parameters. So here is some of the columns that we are using in a data set. So it's a mixture of medical information, socioeconomic status, and information about their way of living. So this is going to be inputted into our machine learning algorithm for to generate, and in that machine learning algorithm, it would do some computation, some probability function uh, algorithm to generate the model. So here is the steps in detail, the steps in generating the machine learning in detail. So the pre-processing, we are determining the columns from the dataset that would be used for predicting the result. We normalize and converted some of the datasets. So for example, we converted the yes or no data into ones and zeros and converted the other more complicated, we encoded the other more complicated data in the dataset. And we converted all of those data in numerics. And also we eliminated unnecessary data like incomplete data and data that is incomplete data in column and data that we think we don't need for the algorithm. Next is after the data has been pre-processed, it will be used for testing and training for the machine learning algorithm. The, the training part is to generate the model, and the testing part is to assess the performance of the model. The models generated by each algorithm will be compared by each other by the F1 scores, and if needed, the parameters would be tuned, and once it's tuned, there would be another round of testing and training. So the result, based on F1 scores, it's clear that the best model to use in our case is the random forest. So it's since it has the overall highest accuracy in training and testing and the overall highest F1 score for the positive and negative cases. So in conclusion, our study expanded on remote setup as a solution for a more accessible prenatal care. So, but we are aware that more research is needed for the product to be available for commercial use and to have a bigger impact. So further improvements for the database would make the models more accurate during the machine learning part, and adding more sensors, adding more features are to further aid doctors and other healthcare workers for the remote access assessment and give a more accurate diagnosis. And having another effect is having a simple localized and remote prenatal setup could actually make women get prenatal health more frequently and become more aware of both their own health and fetus's health.